to all the attendees. Can you hear me, please?
Yes, ma'am. Yes.
Yeah.
Good morning, Madam S.
Yeah. Yeah, so today's session is on integration of psychotherapy in the homeopathic management of mental diseases by Dr. Ananya Chitre. She's the ex-students and alumnus of the college and presently into homeopathic practice and also into psychotherapy, and one of the very sincere students, and today a very efficient and practitioner, and both are psychotherapists. Although the formal introduction will be done by Dr. Yogesh, the present seminar is nothing but a part 2 or a continuation of the sessions held in December, where psychoanalysis and psychology correlation to homeopathy management in terms of case taking and therapeutics was discussed along with a case. And today we'll be continuing with more practical and implementary practices of psychotherapy into integrated homeopathic practice. Psychotherapy per se actually was Hahnemann introduced, and he was practicing much before even the advent or discovery of homeopathy. Way back in 1792, okay, Dr. Hahnemann treated many dukes in Europe. To name a few, Duke Anhalt was treated of his anxiety disorder. In 1792, Duke Saxe-Gotha, okay, from Georgenthal, he gave almost the entire hunting castle of his to Hahnemann for his psychiatric practice, wherein he treated one of the very famous Coquelin-Bring patients. Okay, he was a very social luminary. He treated him and thus established homeopathy in Europe. So after epidemics, psychotherapy proved to be a very instrumental in establishing homeopathy in Europe. Thereafter came 1796 when Hahnemann formally introduced homeopathy as a system in Europe, in Germany. So with this brief introduction, psychotherapy becomes as an integral part of homeopathy, even much before the system developed. Okay. So along the same lines, we carry the thread and try to understand psychotherapy as understood today, which will be contributed by Dr. Ananya. Yeah, I hand over Dr. Yogesh to introduce the speaker.
Thank you, Dr. Bhosle, ma'am. Myself, Dr. Yogesh Mandle from GD Paul Foundation's YMT Homeopathic Medical College, Assistant Professor at Organ Department. About our speaker, Dr. Ananya Uchitle is a MD Homeopathy Psychiatry, Homeopathic Psychiatrist and a psychotherapist practicing in Pune since 9 years. She is trained in ACT, that is Acceptance and Commitment Therapy, under Russ Harris CBT, Cognitive Behavior Therapy, from Beck's Institute, USA. She is also trained in Dialectic Behavior Therapy, currently working as a consultant at Emoticons India owned Misohe Virtual Mental Health Platform, also as an advisory board member at Notacute Educational Services, Associate Professor at Dr. D.Y. Patil Homeopathic Medical College, Pune, and also a member and director of Youth Services at Rotary Club for Addiction Prevention 3141, and in past has worked as mental health consultant for Converges Pune, has also worked as a psychiatry medical officer and research fellow at Department of Psychiatry at Dr. M.L. Dhole Hospital, Palghar. I welcome Dr. Ananya Chitle ma'am. Before starting this session, after finishing Dr. Chitle ma'am's session, we will have a question answer series. Okay. I welcome Dr. Ananya Chitle ma'am.
Thank you so much, Sneha ma'am, and thank you so much, Yogesh sir, for the introduction as well as warm welcome. Okay, so right, so I'll just share my PPT. Give me a minute. Okay, I hope my PPT is visible, right? Yeah, okay. So before I start, let me just tell you a few things, because once I start sharing my screen, I won't be able to view all of you. So anybody has any doubt or wants me to repeat anything, please unmute yourself in between and directly ask your doubt or whatever you want to share, you might share, okay? And yeah, as Neha ma'am rightly said, this is more like a continuation from one session that we had in December, where I just briefly introduced to you all about the concept of psychotherapy and what are the parallels between homeopathy and psychotherapy. Okay. Now, today, as the topic says, we will focus on integration of psychotherapy in management of homeopathic management of mental diseases. Okay. So before I start my thought sharing, I would want to know, 1 minute, it is not, okay. Yeah, here it is. I would want to know if anybody has got any significant experiences while managing mental diseases in your practice. Can I have a couple of views, if at all you might have encountered any mental diseases of any sort, depression, anxiety, anything, and while you treated it with homeopathy, what was your experience? Anybody would like to go? It's okay. I mean, experiences are experiences. There is nothing right or wrong about that. And plus, I would like to have this session to be made a bit more interactive so that it just doesn't become too boring. Okay, no worries. So just to give you a brief idea that why I per se ventured into the field of psychotherapy, when I started my practice back in 2013, somehow my practice started with majorly psychiatric cases, because the area where I practice is a IT hub of Pune. It's located near the IT hub of Pune, and somehow my qualification, which stated MD Home Psychiatry, that brought me more into psychiatric cases. Now, conventionally, as we would go ahead, that we would take a case, we would arrive at totality, we would select a simillimum and prescribe it to the patient, be it a case of generalized anxiety disorder, or be it a case of postpartum depression, or be it a case of schizophrenia. Any case, this is what we would start with, or rather, I would also start with, okay? What I noticed was that many times the homeopathic management where we give simillimum would certainly help the patient, no doubt about that. But somehow I realized that they also needed one more intervention, because there would be relapses. So 1 year down the line, I would meet the same patient coming back to me and saying that his anxiety is back again, in spite of the fact that the constitutional medicine is going on, it has initially treated. I started to review my cases. I started to see whether my initial prescription was not that proper, whether there were faults in my simillimum or my repetition, etc., etc. And I realized that no matter how much ever times I review the case, even if I see that there is a better indicated simillimum or better indicated phasic remedy, I start that, I couldn't get that permanency of results. And that's where I realized that maybe psychotherapy is one of the modality which has been scientifically proven to have significant efficacy in managing mental health issues, is something that I should think of. And that's how I ventured into this entire zone of psychotherapy. Okay, even in my MD days, if I want to reflect back on my experiences, I still remember when I worked for a research project on alcohol withdrawal syndrome. I would say that the patient goes through withdrawal. We manage withdrawal homeopathically. The patient is out of it. He's put on constitutional. He joins Alcohol Anonymous group, which is, more of a group therapy, which is offered in alcohol addiction. But yet, in spite of being on AA group, being on constitutional, the patient would still relapse back into addiction. So combining these experiences, I thought of venturing and exploring this whole zone of psychotherapy and seeing its utility in our regular homeopathic management of mental diseases. And this journey is what I am trying to put forth in front of you, and my views regarding this whole scenario via, of course, case vignettes, discussions, and if time permits, a quick activity with all of you all. Okay, so going ahead, I'm going to directly start with a case as usual. So this is quite a recent case that way, but I thought let me share this because the experience is quite fresh for me to put it forth. So this is a case of a 10-year-old female. Now, the mother of this child who approached to me for issues has already been my patient since 2013, where she suffered from panic disorder, depression, and she was also having dependent personality disorder. Okay. Now, if you want to really go through the case of this entire mother, I have done a YouTube presentation only of that particular case of the mother of this child. You might go through that presentation as well to get an entire idea about how psychopathology runs in families. Okay, but keeping that aside, so this mother who has already been my patient, who was well out of her psychiatric issues now since last 4 years, she got in touch with me for her 10-year-old daughter via WhatsApp chat on 12th October 2020. So that is almost 2 years ago, when the COVID first wave was just going on its low. So you can see the WhatsApp chat here. The mother said, hello, whenever you are free, can you please talk to Miss M? That's what we call her for today. Over WhatsApp chat, she's going through something and she asked me to ask you for help, but she can't voice chat, she will type. Now, this child has known me because whenever the mother would come to me for follow-up or for her sessions, the child would be there and Miss M would sit outside, and she knew that when mama comes out, she is much better. When she takes medicines from this doctor, she's much better. So this child already had this thing in her head that, okay, maybe now that I'm having something, maybe auntie can help me out. Okay, so that's why she told her mother, and the mother texted me this. So I said, yes, of course, I'll connect in 10 minutes. And then the child Miss M started to text me that, okay, hello, this is me. I am not feeling so good these days. I don't know what it is, but it just doesn't feel good. I don't know what to do about it. I have told my mom, but I don't see any change. I want to go out, but I know I can't. I feel like vomiting, but I don't vomit. I feel like something is moving in my stomach. I feel like doing something, but when I ask someone what I can do, they just tell me things I don't want to do. And but I do want to do something about this, and I just feel like I'm nervous for something, but I don't know what. Are these all problems of feeling nervous? This is what a 10-year-old Miss M texts me. So I obviously said that, okay, I assured her, I said that, yeah, okay, it can happen for the kind of times we are into, our normal lives are not yet back, etc., etc. I reassured her. And then she also further texted me saying that it is not only about going outside. I want to not feel like how I'm feeling. I need help. Even when anyone makes me feel happy, I get irritated. Before, I used to laugh. I feel like crying anytime. I feel annoyed these days. I don't know. But it just happens. Okay. Now, all this was going on WhatsApp chat. So obviously, I was not very comfortable chatting on WhatsApp because clearly I needed to see this patient of mine. So I told her that, okay, right. Firstly, let me appreciate you for reaching out to your mom and then to me, because asking for help is the first step towards solving any issues or problems. So I somehow managed to get her on a video call, because I was out of station that day and I was not available immediately. So I thought might as well I have an online consult with her. So video call was done with this child, and whatever came out of that talk with the child is this. So Miss M said that there are a lot of fights between mom and dad. Her dad tried to cut his wrist a couple of times in last 3-4 months, right in front of her mom and her brother too. Okay. He pushed her mom hard, hit her once when she tried to intervene. Miss M said that father keeps saying that mother has ruined his life and he doesn't want to leave. And if he can't kill the mother, he might as well die. Miss M always feels anxious since then, even when little voices start getting raised and she feels that there might be a quarrel between her mom and dad, she starts getting anxiety, she feels choked. And these quarrel related incidences keep happening off and on, although the cutting of wrist has happened twice. But the quarrels, which are of magnanimous proportion, do keep happening on and off. And that really makes her scared that what if something really happens to mom or dad? What if one of them dies or both of them dies? Would she be left all alone? She doesn't want to live all by herself. She just can't. Because of all this, she can't sleep. She needs to sleep between mom and dad, tightly holding each one of them's hand. She gets dreams of ghost startles. Mom and dad is too busy. Her bhaiya, she said, is always round in phone and tells her to go away when she tries to talk to him, play with him. She feels very lonely, feels no one cares for her or even loves her. Most of the times she feels angry, irritated because people are just pestering her to do things, to study, to keep her room fine, to attend online school, to do all homeworks, everything. But she doesn't feel like doing any of that, and that all creates frustration for her, where she just wants to yell and cry. And all this is actually going on since last 7 to 8 months. Okay, but with the lockdown starting in March 2020, all this sort of escalated. Now she's at a step where she literally used these sentences like, I don't want to live like this. She just wonders, why can't all of this just end? And if this can't end, then why I should not end myself? She doesn't feel like doing anything. And yeah, as I said, and all this has started the first time the father slashed his wrist. She's still scared. And the first incidents had happened somewhere around March 2020 when the lockdown started. Now, this is the scene. Okay, to give you a bit of the background from about the family. Both her parents are highly educated. They both are working, but since pandemic started, they have been working from home, and that possibly had escalated the issues between the parents, because as we know, with the work from home scenario, the dysfunctional patterns in the family have gotten much more right on their faces, and they have become much more aggravated. And that's what exactly happened in this family. Parents were very strict when it came to academics, both mother and father. Plus, mother has been more into helicopter parenting right from her childhood. Because now I know that mother, I can tell you this, that right from her childhood, the patient's childhood, this Miss M's childhood, the mother has been very protective. The moment the mother would feel that Miss M would fall while playing, she would scream out aloud and ask her to stop and not send her to play for next 2 days. So that has been the kind of protective parenting. Grandmother is there, but she's almost negligent, busy in her own world. During the birth of Miss M, the mother was very disturbed because of the continued family issues and problems with husband. She suffered placenta previa. Full-term cesarean was done. Post-delivery, mother herself was into postpartum depression, so she couldn't give that initial bonding and attachment to Miss M, even when Miss M was at an infant age. And she has seen mother panicking, getting depressed, sad on smallest of the things, because when Miss M was very, very small, mother was struggling through panic disorder, depression, and dependent personality. Plus, father himself seems to be having a lot of his own issues. Father has been extremely short-tempered, or anger outbursts is what she has been always seen in the father. So this is what is the environment in which Miss M has been functioning till now. Okay. Now, if you focus on this scenario, I don't think there is much of an issue if we want to figure out a homeopathic remedy, right? If we just focus on these few things, that she's facing a traumatic situation where she can see that one of the parent may or may die because of their own doings, but whatever it is, that's the situation that she has been facing, or she has faced actually. She feels anxious. She's always scared. She doesn't want to be left alone at all. There is fear that she might be abandoned. She might be left all alone. She sleeps between mom and dad, tightly clinging them. She dreams of ghosts. There are night terror. She startles badly. She breaks down into sweating episodes. She feels very lonely, feels no one cares for her. Okay, she really wants that something should end and there should be some light at the other end of the tunnel. So if this is the scenario, any quick remedy guesses for that? Physical symptoms, not much characteristic at that point of time when I took this case. She was thermally chilly. Cravings was sweet. Aversion was oily food that made her feel nauseatic. Apart from that, not much of physical symptoms. Oh yeah, there were a couple of symptoms like perspiration on palms and sole, etc. Okay, at that point of time. So any quick guesses on the remedy and how you would want to manage this case? Any quick thoughts anybody would like to share? Or if not, any quick guesses on the remedy? You can type or you can just unmute and put it forth. 2-3 remedies that might come to your mind when you see this. No guesses? Okay. Okay, fair enough. So diagnosis. Okay, so if you open your DSM-5, which is our Diagnostic and Statistic Manual for Mental Illnesses, this picture classically fits with the criteria given for post-traumatic stress disorder. Okay, plus her suicidal ideations, her helplessness, and her irritability, her crying spells, lack of motivation, not wanting to do things of her regular work also. This all fits into a depressive state, although it doesn't fit into any classical depressive disorder as of now. Okay, so clinically, psychiatric diagnosis is pretty clear that this is a case of PTSD with depressive state. Now, coming to the management, if you refer again, Hahnemann's aphorism number 221, what it says that when you have mental issues where there is sudden ailment from, for example, in this case, we have fright, then what we have to do, we have to give the well indicated remedies, mostly those that belong to the soric class, such as stramonium, aconite, belladonna. And incidentally, this case rightly fits into the picture of stramonium, and that's what I exactly did. Okay, I started with her stramonium 1M once a week for 3 weeks along with Saclac. Within 3 weeks, her sleep improved. There were no nightmares. She was comfortable sleeping in her own room. There was not much of an anxiety. She started to proactively attend her school lectures. She started to do her homework. So overall, she quite drastically improved with stramonium 1M. And of course, yes, the parents also, the father did tell me that he won't go and slash his wrist the next time. At least he committed me the same. But the impact of that 2 incidences was definitely taken care by stramonium. And after that, I decided to even follow it up with constitutional remedy and with a little bit more of a case taking. Silesia 1M suited the picture, considering some physical complaints that she would get. She had recurrent sinusitis and typical silica modalities, etc. So Silesia 1M was given once a week for 2 weeks. Okay. Followed that, all this current picture drastically improved. I did psychoeducated the mother about possible need of counseling sessions, not just for the daughter, but also for the family. But as usual, you know, although mother was quite better after counseling and homeopathy, she was absolutely fine. In fact, she couldn't digest the idea that a 10-year-old child, बच्चे का क्या ही counseling कराना. And same was the ideology of the father. He said, कुछ नहीं, उसका तो नाटक है, 2 थप्पड़ मारो, शांत हो जाए. Okay. So with this thing, they did not really come back to me for any mental health issues after first 6 weeks of stramonium and silica, because most of the things went down drastically. The mother would follow up with me for her till September 2021 for, you know, recurrent sinusitis, some here and there physical complaints. So it's not that constitutional was stopped, constitutional remedy went on, and that was relieving her in other physical complaints also. September 2021, till then, this was the picture. What happened? November, December 2021, This Miss M happened to go to her native place, which is at Rajasthan, and apparently there she started to suffer with constipation. Now at Rajasthan, she was with her mama, so they thought that it could be change in weather, change in water. It wasn't that bad initially, so they did home remedies, and wahan pe unhone they showed to the pediatrician over there, etc., etc. But then what happened is, sorry, okay, I just missed a part. No worries. So sorry about that. Okay. So what happened was that she went to Rajasthan, and she again started with this constipation, but it did not get better. So that's where her mother connected back to me on January 2022. That is this year. After 2 months, they tried, tested, nothing helped. So when she was back to Pune, the mother connected back with me. So that story becomes the interesting one. Now I'll tell you that story a little later. Now my question, or rather what I want you all to reflect, is that we have given stramonium, we gave Cilicia, apparently she improved, she has remained in an improved state, not any significant symptoms, at least not what the parents reported or the Miss M reported back to me about disturbances in psychological state were there. So do we think that it is going to be, is this all enough? Okay. Now, as I said, given by my experience, I was skeptical. Okay. I was not very sure that the case has been successfully dealt with, right? There are some reasons why over a period of time, I have realized that only homeopathy might not be enough for most of the cases. Again, I'm making a careful statement here that most of the times it might not be enough, because yes, there are certain mental health conditions that there is one acute breakdown, you give the similimum, patient is absolutely fine. Okay, I have those experiences also, but those experiences are quite few. The dynamics of this nature, usually homeopathy might not be helpful. I'll tell you why. Let us first understand why mental health diseases occur. Okay, what understanding we have since Hahnemann times till date, now that the research has advanced a lot in the field of psychiatry and psychology, right? So any psychopathology, why it evolves, we have three concrete explanations today for that. The first is the biology, second is the behavioristic aspect, and third is the cognitive aspect. I'll just brief you all about that. Okay. 1 second, there's something in the chat box. Yes, Dr. Fareen, you're right. McCabe was one of my differential diagnoses for this. Okay. So, but of course, I would not go into discussing why I chose stramonium or silica, because that's the entirely homeopathic case discussion part, which I might not be able to cover in this session. But you're right, McCabe was another very strong DD for this case, no doubt about it. Okay, so genesis of psychopathology, coming to the first aspect. Now, lot of researches have been done where modern science has been able to sort of prove that most of our mental illnesses have, or rather they evolve because of abnormalities in the brain anatomy as well as physiology, because of the abnormalities in the neurochemistry. For a simple example, if you study the MRI scans of two patients, or rather one patient of schizophrenia and a normal human being, they have clearly found that in schizophrenia, over a period of time, they have seen that the gray matter in your frontal and temporal lobe goes on reducing, okay, as the disease progresses, okay. Whereas in a normal human being, the gray matter in the frontal and temporal lobe is quite intact. Okay, so what they have, this is one small example that I'm giving you. Similarly, I've studied a lot of brain scans and brain images of pre and post interventions and normal and those who suffer from mental health issues, and they have compared and they have found that there is definite change in the brain anatomy when we are talking about somebody who is having psychological issues, right? So similarly, they have studied neurotransmitter levels in your brain and synapses, and that's where they have found that people who are in depression, we all know that, right, by now, that people who are in depression, the serotonin levels are significantly low, the dopamine levels are significantly low. Okay, so that's why these modern modalities or modern medications that we have in psychiatry, that they aim at rebalancing, restoring those neurochemicals which are going low, which cause depression. And we do see that when a person is put on antidepressants, yes, his mood does improve. When a person is put on antipsychotics, yes, his hallucinations stop. Okay, we can't deny that fact. Of course, the limitation to this, using only this approach in treating mental diseases, is that simple example, schizophrenia. When you start antipsychotics, what happens? The positive symptoms of schizophrenia, that is delusion, hallucinations, they come down, but a set of negative symptoms, that is inability to experience happiness, what we call it as anhedonia, or inability to feel motivation, that doesn't come back. Okay, so this only biological concept of understanding psychopathology as a cause is not adequate, but it is definitely there. Okay, so genetic inheritance, we can study many cases of psychiatric issues where one has a proper psychiatric illness. Somebody who is closely connected to that person in family has had history of some psychiatric illness, at least in 1 or 2 generations. Okay, so if a person is born with that genetic inheritance, or if there goes something wrong in the brain anatomy or neurochemistry, a person might land up into psychological illness. That is one established cause. The other cause is the behavioristic cause. Okay, this what they have found is that all our behavior, now when I talk of behavior, it is not about the behavior, it is also about the way our mind behaves. Okay, so the way we feel emotions, the way we think, the way we act or react to a particular situation, they say, is learned through our experiences. Our experiences mold everything. Okay, which is again a quite well proven concept, that your experiences build your patterns of thinking, feeling, and action. For example, just imagine a child is sitting on mother's lap, a small child, okay, say 1-year-old child. A child is sitting on the mother's lap, and there is a big spider that the mother sees, and mother shouts and drops the child. Okay, the child has listened to a very scary voice, and at the same time he suffers injury, okay, because the mother dropped out of fright. Now, what does the child has learned? The child has learned that whenever there is a spider, there is something wrong that happens to me, and that's how I develop a fear towards spider. Okay, so I associate initially neutral stimuli with fear, and that's how I start developing the phobia of spider. Okay, or this is one aspect. This is what we call it as classical conditioning. The second aspect is that all our behaviors are shaped by the consequences that we receive from our environment. Simple, right? We all have experienced this. You prepare a great PowerPoint presentation and your teacher appreciates it. What you will do, you will follow the same method of preparing PowerPoint presentation with same dedication, same sincerity, so that you know that if I do this, I receive something which makes me feel good, which makes me feel rewarded, which secretes a lot of dopamine that makes me feel happy. Okay, so all my experience, all my emotions and thoughts and behaviors will be shaped by the consequences. If I don't receive any appreciation, what am I going to do? I don't care, I don't want to prepare a presentation. Itna karke bhi kya hi mila, right? So we adhere to that pattern of thinking. Exactly that happens even in psychological, psychiatric conditions which evolve. Okay, and other aspect of behavioristic theory is that social learning theory, that all of us tend to imitate what our people around us do. Okay, simple example, एक बार मैं absent रहती हूँ तो I don't get punished, और बाकी लोगों को भी मैं देखती हूँ, बाकी लोग भी absent रह रहे, they don't get any punishment, so might as well I will keep continuing to remain absent. That's what I have learned. I imitate from others. Okay, I see that somebody uses aggression to shut down somebody, and that works. In my life, if I want to shut down somebody, I will use aggression. Okay, that's how aggressive behaviors develop, right? So that is one thinking. And the last established causation or genesis of psychopathology is cognitive aspect. That is, it simply says that the way we learn to process our information and think about the whole situation will decide how we feel and behave. Okay, so if somehow since childhood I developed a thinking pattern where I will always jump into thinking worst case scenarios, I am going to land up in anxiety. Okay, so for example, if I see that I have a boil on my face, and I will assume that now my boyfriend is definitely going to break up, I am jumping to a worst case scenario. Okay, so that is going to make me feel terrible. But why it is making me feel terrible? Because I am thinking in an extreme manner. Okay, so the way we think, the way we feel. So if we keep thinking bad, if we keep thinking in an unhealthy, unhelpful way, we are going to land up in depression or anxiety. Okay, so if this all is how psychiatric illnesses develop, right, then we really have to think at what level homeopathy might be going, and being able to bring a change which will help the patient to get out of it, right? For example, when I say all our fears, if I explain the biology of anxiety, all our fears come because our amygdala is super active. Okay, amygdala is a storehouse of past experiences. Amygdala stores the emotions which we have gotten from previous experiences. Amygdala is the first respondent to any threat in our situation. Okay, so a person who suffers from anxiety, in that, if I want to understand biologically why he might be anxious, I would say that his amygdala is overactive and it does not let the prefrontal cortex overtake, okay, or take over in the situation. Prefrontal cortex is nothing but our rational thinking mind, right? So does homeopathy, when I give medicine, does it establish the connection between amygdala and prefrontal cortex, and that's why the fear goes down and my rational thinking mind takes over and I start feeling better? Is it how homeopathy helps? I don't know. Is it goes at that synaptic level and it somehow brings the equilibrium back into the synapses and secretes normal amounts of serotonin, and that's why depressed patient feels better? I don't know. Okay, if this is what might be happening, is that enough? Because in person's life, if experiences are constantly negative, will homeopathy help the person to stop taking in those experiences and forming his thinking patterns accordingly? We don't know. Okay, that's why we are not sure if homeopathy can help. Because now, for example, if I want to apply all this into this child's case, this we will apply all these discussion into this Miss M's case. Okay, what you are seeing just now on your screen, we call it as case formulation. Fine. Case formulation is nothing but summarizing or understanding your entire patient's life and the problems and the crisis at 3 levels. Okay, biological level, psychological level, social level, and identifying what are the various causes at all these biopsychosocial level which have contributed to put the person in the problem. So you can see in the 3 vertical columns, first column is where we are going to put various biological causes which might be responsible for this Miss M to suffer. In second column, we are going to put down all the psychological processes that have developed within Miss M, which are putting her into the problem. And the last column is the social, where we are going to put down all those social causes which are putting Miss M into such problem. Okay, and these causes are again at 4 levels, right? Predisposing cause, which we call it as vulnerability. Okay, so something which makes a person vulnerable, basically the soil of that person. Okay, precipitating cause, that is the trigger or the active trigger or stressor which triggers the full-blown psychiatric process or problem. Perpetuating cause, we call it as maintaining cause. We're quite aware of this concept even in homeopathy. Any factor at level of biology, psychology, or social level which will maintain or help continuing the problems that the patient is facing. And last are the protective causes, which also we have to identify. These are sort of strengths in that patients in light of all these problems which are preventing the person somehow to not get into complete deterioration, or which might be helpful for this person to come out of the problem. Okay, so last is protective. So that also we have to identify. So if I would like to summarize here, You can see biologically, as I already said, mother had a lot of psychiatric issues. Father possibly is going through major depressive disorder, I don't know. But he certainly has been showing narcissist or oblique borderline personality traits, which I know because I've treated the mother. Mother also had postpartum depression immediately after child was born. Neither the mother was mentally fine during her second pregnancy. Along with that, if you see the social factors, since Miss M is born, she has seen extremely fluctuating parenting styles. Whatever parenting styles have been adhered to are not very conducive, giving her a lot of negative experiences. Attachments, which are the fundamental part of a child development, haven't been formed properly. And she has seen coping styles from her parents, which have been unhealthy again. That has led her to develop within her poor affect modulation, which is nothing but poor emotional regulation skills, low self-image, lack of self-resilience, poor coping mechanisms. Because how does a child learn to cope? He learns to cope by seeing what adults do. Okay. Trust, mistrust, trust stage, which is the a hallmark of Erik Erikson theory. I would like you all to read Erik Erikson theory, has not been negotiated properly, which has put her in a very insecure place right since childhood. Now, if this is the soil that we have, we are looking at predisposing factors or vulnerabilities at level of biology, psychology, and her environment, then this, when acted upon by stressors at the level of biology, again, when I talked with her, she had vitamin D as well as B12 deficiency, and seeing violence in the family, the suicidal attempts, the father beating the mother, lack of good role model, again, lack of secure attachment, lack of validative environment. When these factors act on this soil, we are going to have a person who is struggling to get love, struggling to get validated and accepted, who has developed an awfulizing tendency. Awfulizing in our therapy language, it is nothing but someone who has a tendency to always jump onto worst case scenarios for even the smallest or even neutral trigger. She is internally developing helplessness, hopelessness, which has put her into depression and PTSD. Now, if all these above factors haven't gone anywhere, okay, then I am anticipating that she will continue growing up like this, where she will have underdeveloped self-regulation skills, her resilience will not be developed, neither would develop her healthy coping as well as thinking patterns. So I am very strongly anticipating that this case is not yet done by stramonium and silicea. Okay. But at the same time, when I interacted with the girl, you can see even from her WhatsApp chat, at the age of 10 years also, she was quite much clear with what she's going through. She had a lot of ability to introspect and retrospect at the age of 10. She was eloquent in communication, and she had good insight as an awareness about what is wrong with her and that she needs help. So these are the factors, along with that mother being aware of how mental health is and how illnesses happen. She might get ready further for proper treatment follow-up and need-be sessions. So these were the factors on which I was banking upon till the mother got back, right? So that's why, if we see all this, we are not very sure if homeopathy can be enough. There are reasons again, not just because I think that, okay, itna multiple cheeze hai, to ek dose apna kaise kaam kare. It's not just that. For any intervention, when it wants to position itself as very strongly effective in a particular field of healthcare, we need research. And right now we're struggling with some gray areas in homeopathy. Okay, just to highlight a few, we all have got experiences where we have dealt with psychiatric cases individually, right? Ki nahi, maine aconite diya, patient was absolutely fine. But those are anecdotal reports which are not sufficient to understand the depth at which homeopathy can help or cannot help, vice versa. Okay. Whatever researches we have done, they are on an inadequate sample size. They haven't been done at a massive scale. Neither have been they done where every single psychiatric entity has been tested with homeopathy. Many of the researches that we have done in psychiatry with homeopathy are without control group or without comparator group, because as I always said, even in my last lecture, that many times our homeopathic case taking itself has lot of aspects of counseling, empathy, unbiased attitude that we give to the patient. They all are itself psychotherapeutic. So we don't know that when a patient becomes better in 2 or 3 follow-ups, is it only because we gave homeopathy, or is it because the other factors also worked, right? So to control that variable, we need control groups or comparator groups. Our duration of studies that we have in psychiatry, 6 months follow-up, 1 year follow-up in chronic psychiatric cases is not enough to understand sustainability of efficacy of homeopathy in mental health issues. Okay, some psychiatric illnesses are very, very long standing. So their 2, 3 months, 6 months follow-up is not adequate, right? Most of the studies which we see today, a lot of variables are not well controlled because of the inclusion and exclusion criteria is not being strict. Plus, we don't have a lot of pre and post-test study designs. And if we have used pre-test, post-test tools, many of the tools haven't been validated or haven't been used in a proper way, they are flawed. Okay, so this puts us in slightly dicey position to position homeopathy as a mainstay of treatment in psychiatric illnesses, right? Irrespective of that, I came across this interesting paper, which you all can also go through, is that this is a meta-analysis done of various homeopathic and homeopathy in psychiatry studies, where they took a lot of studies where homeopathy has been given in psychiatric issues, and they evaluated that whether homeopathy eventually works or no. And to our pleasant surprise, it does say, this paper has been published in PubMed, so quite authentic one, of course. So it does say that positive evidences are seen for the effect of homeopathic remedies for mental disorders. But again, they are using their words carefully, positive evidences, okay? They do say that homeopathy cannot be used as only therapy, but it can certainly be used as an augmentative or an add-on therapy. And that's why they also say, because we don't have side effects, it's generally tolerable to everybody, we must try out homeopathy in cases of not just mild disorders, but even severe chronic cases. So that is what meta-analysis says about homeopathy. Right? But we have to figure out all these areas, because we do know somewhere that only one dose of our homeopathic remedy might not take care of this complicated dynamics. Okay. So exactly as per my anticipation, same thing happened after, that 2 months constipation thing that went on. Finally, the mom called me to ask me if she can meet me with Miss M. Unfortunately, my son was diagnosed with COVID then, so I was under isolation. So I said that I might not be available just now. So then the mother asked me that, can I suggest a good pediatrician in that case? So I told her to get in touch with my son's pediatrician. And she went there because the initial pediatrician had really frightened the family, saying, this is something really grave, we must do sonography and whatnot. My pediatrician told that there is nothing to worry. It is a case of chronic constipation. He gave some laxatives, typical, typical medicines that we give. He also suggested that if 3-4 days, if this doesn't go away, we will have to go into enema. So that was the scene. On 28/1, this was the scene. On 3rd, the mother reported to me that Miss M is crying for 1 hour right now, anal area pain. She's reluctant to put the cream that doctor has given her. She says that she gets pressure every now and then, so she keeps lying. And if she stands, she has to use washroom. She's soiling her underwear. So I said, let me connect with her now, because I don't think anything is working for her. She was not even ready to put the creams given. And when the mother said that in that case, we have to give enema, which the doctor had prescribed, she got super anxious about it. So I realized that maybe I have to get in touch. So although I was in isolation with my son, I told her that we shall connect. And I connected with her. I realized that it's a chronic constipation. The picture hasn't changed, nor her physicals have changed. I sent her Cilicia 10M and I asked her to take 2 doses dissolved in water, 1 dose stat and 1 dose in the night. The next day follow-up is this. The mother said that, I think the medicine you sent is helping her a lot. Mother started to complain that she was also having something, etc. But then I told the mom that, okay, for Miss M, let's continue the same way. I had given her the Saclac also, so she had to take that. Mother said that, okay, enema, I'll return to the medical store, because now the Miss M had gone 4 times to pass stool since morning. It is soft and she's feeling okay. So mother said that she's doing quite better. So that episode was sorted. But I still remembered my pediatrician had connected back to me saying that the child is super anxious and there are lot of things more than constipation. It looks like more of anxiety, and I could sense that should be the case. Again, I got to know that, okay, medicines have helped her, etc. And then after 5 days, that is on 10th February 2022, the mother texted me back again that she's all better. But then the mother came up that she is been having lot of internal fears. She said that slight tooth pain, she will jump thinking that it's a cavity and she needs immediately to go to a dentist. Yesterday, she was crying for hours thinking that she's got a cavity, and now she has to go to a dentist and dentist will give her injection. She has to get a painful root canal done. She just couldn't stop thinking and imagining all these scenarios. She also said that she has complete aversion for studies now. She doesn't even want to look at books. So I told her that, okay, time that I should get in touch with her properly and maybe start her sessions. Further, the mother also updated me that since the first episode where I prescribed stramonium, she was better, but she was not absolutely fine. These anxiety thing would come up again and again. Now, remember, I said that constitutional medicine was going on back then as well. But those subtle things were still coming up, and now it has again got triggered back. So mother said that she's 11 years old and now running 12. She was soon supposed to complete 12 years of age. Breasts are developing, pubic hair is turning her off. The whole constipation thing has scared a lot. All time she talks only about constipation. Her words again yesterday were that I don't feel like living anymore. Her husband, Miss M's father, got furious at her, and the father had even slapped her again. Miss M is not taking bath regularly, doesn't even want to change clothes. So again, the whole thing. And this has been more or less the thing since again many months. So it never went completely, really speaking. Okay. So I connected with Miss M again on 12th. And from that day, psychotherapy was started. There were a lot of things that were bothering her. Okay, so apart from what mother said, she told me simple things, right? That one day she had gone out with her mother to buy some medications, and she saw ad of a condom on the chemist shop, and she asked the mom that, Mom, it says that it gives pleasure. What is condom and what pleasure it is giving? Mom said, shut up. This is none of your business. Don't ask these stupid questions. And she shut her off. She Googled. She got to know everything about sex, and that's where she again got triggered about her body changes. Nobody to answer her, because as I said, this is the parental attitude. She did not knew what to do with this information, how to navigate through all these sensitive things which are triggering so many questions and at the same time making her anxious. Class teacher had taught about tuberculosis in the school, and they said that weakness is a sign of tuberculosis. And the moment she would feel exhausted, she would go behind the mom asking, Mom, is it tuberculosis? Mom would say, why are you thinking all these things? Shut this off. Father would say, you need to really focus on your studies. Don't enter into this zone. She would go back, Google, and she would receive all the information that she shouldn't. So with all these environmental triggers, now the question becomes that, again, whether only homeopathy might help her to develop those proper information processing patterns, whether homeopathy. So what we are looking at, homeopathy might help her to calm down a bit, to get reduced her anxiety. But what about these things, right? So that's where I decided that maybe I might just want to start psychotherapy, structured psychotherapy, and I started that. Therapy was based majorly on rational emotive behavior therapy, cognitive behavior therapy, and ACT therapy principles. ACT is acceptance and commitment therapy. And from 12 to sorry, it's not 19 to 22, okay, it's 19/5/22. So till last week, okay, total 22 sessions have been done. Initially, it used to be twice a week, followed by once a week, right? These sessions were aimed at catharsis. She needed to express herself unconditionally without being judged, without being said that you are stupid, don't ask this, don't say this, don't do that, why are you getting scared? Look at me, how strong I am. She did not need all this. She just needed to be herself. So catharsis, which was followed by unconditional acceptance, lot of freedom of expression with validation, validating that, okay, your fears are true. Okay, your fear is not that you're acting, it's not that you're feeling something stupid. Your fears are true. One can get scared. So just validating her emotions, solving her doubts about health and disease, because let me tell you one thing, this girl has an IQ of 120. Okay, which is what the IQ test done said. So she is very much understanding everything. She's otherwise sensitive. So she had a lot of doubts about health and diseases. And when nobody was answering her, she was Googling it up. She needed some filtered, correct information. So I remember 2 sessions going on only discussing about all the doubts that she had. Okay. And then the therapy aimed at 3 things: cognitive diffusion, cognitive restructuring, and mindfulness. All these are jargons, but let me simplify it for you. Cognitive diffusion means that we believe that it is okay to think negative. What is not okay is staying in that negative thinking. What is not okay is being fused with your negative thinking. Okay, that's where we have to first teach any client that negative thinking, fine, but you need to unhook yourself from that. Okay, unless and until you unhook, you won't be able to change this. Right? So cognitive diffusion means exactly that, diffusing yourself from, diffusing your negative thoughts by detaching from that. Okay. Again, this is done by various fun activities. Followed by that, once she was able to take a distance from her overwhelming thoughts and emotions, then it was a time to restructure all those thoughts and emotions, restructure how her brain was interpreting information, stimuli, trigger from outside environment. Okay, that's what we call it as cognitive restructuring. What we do is exactly, we build stronger connections between, as I said, amygdala and prefrontal cortex, because let's not forget, all of us are primed to get anxious whenever there is a problem. Okay, or feel angry whenever we are facing a problem. Why? Because that's the function of amygdala that has been there since thousands of years. Okay, because unless until you get scared, you will not protect yourself. Okay? We are primed with that. That is what nature is. But we have to learn to quickly switch from amygdala to prefrontal cortex, which is concerned with rational thinking, decision making, logic, etc., etc. Right? So all these activities are aimed at nothing but strengthening your prefrontal cortex, strengthening the connections within your prefrontal cortex. Okay. So this followed by mindfulness. Mindfulness to help her. Mindfulness is nothing but being aware of the present moment, staying in the present moment, because as a general statement goes, it is said that the cause of all our sorrows is the fact that either we spend too much of time in future or we spend too much of time in past, but we forget to stay in the current moment. Right? So helping the client to stay right here, right now is all about mindfulness. So for this child, teaching her mindfulness techniques, we don't imagine, somewhere you have to stop imagining and stay in the present moment. So grounding and progressive muscle relaxation. And of course, family therapy. Honestly, that has not been done yet because mother understands certain thing, but it is very difficult for her to learn new parenting style and cut off from the old school parenting that she has received. Father is nowhere on a page to even get the child to counseling. All these counseling sessions have been going without the knowledge of the father, because father is like, do thappad maro, seedhi ho jayegi. That's the only stance the father has. So family therapy is quite needed to address all those, environmental causes which will create certain learnings within her, but that hasn't been addressed yet because nobody is ready for that yet. But all these things have been done, and as an outcome of this is what I got a feedback. Okay, the mother said that Miss M has been doing so well now. In fact, she has become adventurous. She hardly ever gets worried about small things. This mother said specifically because swimming karte wo kaan mein pani chala gaya, she would get scared that I'm going to lose my hearing. That was the sensitivity that she had. The other day, the mother's blood sugar report came a bit high and she was worried. So Miss M told her that, why are you spending your time in worrying about the problem that you might get diabetes? Why not focus on today what you can do and start diet properly? The other day, the Miss M told to her mother, because Papa, her dad, again went into a fit of anger and said nasty things to mother. So she went to mother and said that, don't worry about Papa, we have to wall him off. He shouldn't have power of making us feel bad or scared or sad. We will be there, we will be fine, I'll be there with you. This is what she told to her mother, she without getting disturbed. So again, the mother said that maybe, she should have started sessions back in 2020, because 3 months of 22 sessions, she can see so much of difference with her. Of course, I told the mother that we would be starting to taper the sessions down, and that I'm not stopping the sessions yet. I am still going to meet her once in a month for at least a couple of months and assess that whether she has developed the kind of resilience, whether she has developed those new thinking patterns strongly enough that even though there could be some difficult problems, would she be able to navigate through herself? Okay. So that's what happened. And yes, of course, in these 2-3 sessions, rather these 2-3 months, I haven't really given her homeopathic remedy, because as I said, yes, there could be a debate on the fact that maybe I should not give Cilicia, I should give something else. But again, going by my experience, I've done that in the past, right? Where I felt that, okay, now maybe my remedy is wrong, let me change it and see. And when I've done that, I couldn't get this what I wanted. And that's where psychotherapy comes into picture. Okay. So this is what I wanted to share with you all. It's 12 actually. I was just wondering that I wanted to do a small activity with all of you to give you that experiential realization of what do we do when I say cognitive diffusion. Okay. What do we exactly do? Right? So would it be fine if I spend another 5-10 minutes in doing that activity? Or if you have rest of the schedule packed, then we might skip that activity. Maybe Sneha ma'am or anybody can let me know on that. Okay, ma'am. Perfect. So what I need you all to do, those who can, everybody can participate, by the way. Those who can, I need you to take a piece of paper. Okay, take a paper, maybe like this. Make 6 chits, small chits, vertical strips of this paper, something of this sort. Okay, make some small 6 chits at least of this paper. And I want you to write down on 3 chits, 3 things that you know about yourself, which are really good or which are positive or which are the strengths of you. Okay, 3 things which are positive and 3 things or 3 thoughts that bother you the most. Okay, which really make you feel terrible at times, right? So I want you to write these 3 things about you or 3 thoughts about you which make you feel great and 3 thoughts about you that disturb you the most. So can we all just take 2 minutes and do this 6 chits, and then I'll tell you what we're supposed to do next. Okay, I'm also doing with all of you. I'll stop share the screen for a while. Once you're done, you can just react and give me a thumbs up. So I'm done with my 6 chits. I will write down 3 things that make me really feel good and 3 things that really bother me, 3 thoughts of me which are my demons. Okay, Fareen has done. Cool. Okay, I am also done. Okay, 3 things which make you feel good about yourself, and 3 thoughts or things that don't make you feel great or really trouble you. Okay. Once you have done writing it on your chits, I want you to fold these chits, okay, in such a way that you don't get to see what you have written. Just fold all of these chits. And if you have with you, great, Saritha is also done. Cool. So if you have done, you can fold those chits, okay? Fold those chits. Oh, Page ma'am is here. Good afternoon, ma'am. Okay, so those who have done writing 3 things positive and 3 things that make you feel really terrible, once you have written, fold these chits. And if you have a cup or a container or a purse, okay, you can consider a container or a purse for a while as a cup. Okay, if you have an empty cup, just put all those chits inside this cup. And once you're done with this, let me know. You all can put up reactions if you're done finally with putting all the chits in the cup. Yes, Fareen is also done. Okay. Dipanita is done. Great. Dipanvita, sorry. Let me know if others also have finished. I mean, those who can just now do it, those who can do and they have finished, just let me know. Can I move to the next step? Okay, Fareen says yes. I take it as yes. Okay, Swaliha, Dr. Swaliha is also done. Nice. Great. So I'm going towards the next step then. Okay, so we have these 6 chits. Now, why we're doing this, let me just explain you a bit about this. This is These are the kind of activities that we usually take up in psychotherapy. This is one. We have behavioral experiments such as in vitro, in vivo, because let us not forget that if I just tell you, don't focus on your negative thoughts, just be positive, just focus on your positive thoughts, or try to filter off your positive thoughts. If I just tell you, that's what all our coaches tell us, right? I follow Gaur Gopal Das, I follow Sadhguru. They all tell us this. But when it comes to practically working with our patients, just telling doesn't help, because the most common reaction that I get back is, ma'am, I understand that I should think positively. I understand that there is nothing to fear, but I can't stop it. Okay. I just don't know how to control it, how to do that, how to think positive. I don't know that, right? That is why experiential learning is very important rather than just preaching or talking. Right? That is why we have a lot of such activities. Now, this activity also tries to tell us something, which I used for our case also, by the way. Okay, so now that you have this cup where you have put some chits, when I do it with clients, of course, lot of things go inside. It's not just 3. Right now, for the lack of time, I did only with 6 chits. Now, what we are going to do is just shuffle it. Okay, just shuffle it. And I want you to pull out one chit and open that and see what it is trying to tell you. Okay. Mine says that I do great rangoli. I feel amazing when I do a nice rangoli. Okay. It's a positive one for me, right? Anybody else would like to share what came into their chit if they're comfortable sharing? Maybe those who have done maybe either Fareen or Svalia or even Dipanvita, anybody of you might want to share what came in your chit. You might just share whether it came positive or negative. You might not really share what is exactly written. I can see something in the chat box. Okay, let me see. Okay, Fareen's chit came to her and said that sensitive to every emotional condition. So I get sensitized. I'm a sensitive person. Revati says that her chit told her that I have faith. It's a positive one. Okay, Revati, nice. I have faith in myself, whatever I do. Cool. Put that chit again inside, reshuffle it, and take out another chit. Okay, mine is positive one again. It says that I am a fierce mom. I will do anything for my son, and that makes me feel great as a mom. What has come in your second chit? Can anybody share? Again, as I said, you can just share if it is a positive one or a negative one. A negative one. Okay, Karishma, it's a negative one. Okay, fine. Thanks for sharing. Anybody else? Company better with animals. So you enjoy company. I like company. Okay, that makes you happy. So it's a positive one. Nice. Again, put that chit inside. Raksha's also chit has come negative. Okay. Again, put that chit inside. Take out one more for one more time. And let's see what it says. Okay. Mine is negative. It says that I don't think I'm a good doctor because I can't treat all cases effectively. Sometimes I can't get results in every single case. So it just makes me feel that I'm a bad doctor. So mine is negative. Dipanvita's chit is positive. Okay, interesting. Cool. Fine. So if you just continue doing this, okay, what is happening? If you can see, once it is positive, once it is negative. Sometimes there is a thought that you pick up that is something very good about you, very nice about you. Then the second time what happens, you pick up something which is really disturbing one. Okay, that's what exactly our mind does to us. One fine day something happens, we pick up something negative, we feel bad. One fine day, something happens, our mind picks up a good thought, a good memory, a positive one, we feel fine. Okay. The point of this exercise to explain was that how we should not remain stick to what comes each day to us in this form. Okay, why? Because we are not this one thought, or we are not this one emotion, or we are not this one situation. Okay, it could be positive as well as it could be a negative. What we are not this, but we are this cup. Okay, we are this cup. Our mind is a cup, and it is having everything. It is going to have everything inside it. It is going to be a mix of good ones as well as bad ones. And one fine day, randomly, mind has a mind of its own. So it will randomly pick up something and will make you feel bad. Other day, it will pick up something, it will make you feel good. So that's why we have to learn to not get carried away, not believed by every single thing that mind puts in front of us. Why? Because we are not these one things. We are a mix of everything. We are a cup which can accommodate everything and think beyond these things, beyond this one thought, beyond this one emotion. We can think beyond this. We can look beyond this. Okay, because we are not that one thought, that one painful emotion, right? We are having our good times, we are having bad times. That's how we explain this child also, that you are not your emotion, you're not your negative thought, and you can see yourself as a complete person who has everything and power to accommodate everything and yet live a meaningful life, right? That's what we try to do in our activities. This was just a small demo for all of you, that psychotherapy is not about just talking things or just ventilating. It is about writing stuff, it is about doing stuff, it is about actually experiencing things, actually working on your neural connections. Okay, I'll reshare my screen and just bring this to a closure. So that's how we go ahead every time we use a counseling method or a psychotherapy. So going ahead, okay, to summarize, let's remember that brain is something which is very dynamic. It keeps on changing. It every second, it gets molded as per our experiences, as per stimuli around us. And every experience that we get creates a new wiring within our brain, creates a new connection within our brain, or it will either strengthen the existing one. Okay, and these wirings are the things that are responsible for the way we are going to think, act, respond, react, and feel. Whether homeopathy now can actually alter these connections, establish these healthy wirings, or whether it can shield us off from negative experiences or from taking inside negative stimuli, or whether it can create proper filters, or whether it can create information processing systems which are healthier, we don't know that. That is what we have to scientifically explore and see. Okay, and that's why till then, based on all these things, I would still end this saying that integration is hence more important, and our best chance if we're looking at more or less holistic as well as permanent improvement in our patients who are having mental health diseases. Okay, so yes, that's where I end my talk, and thank you so much everybody from YMT for this patient listening, and first and foremost to the to our organon department and Page madam for having me the second time over here and putting trust on me that I can convey something to you all. So thank you so much for this opportunity. It's such a warm thing to come back to your own college and share your experiences that you have gotten in the last 10 years. So thank you so much for this opportunity once again. Thank you. Okay, I'll stop share.
Yeah, with this interesting session, I would like to call upon the Dean Director Principal of GD Pol Foundation's YMT Homeopathic College and PG Institute, Dr. Page ma'am. Actually, she was to come at the beginning. There was some, time mismanagement, and so she'll just come with her advisory notes to grace the situation. Yes, Page ma'am.
Good afternoon, everyone. Can you hear me? Can you hear me? Can you hear me?
Yes, ma'am. Yes, ma'am. Yes, ma'am. Yes.
Congratulations, Madhura. I will call you Madhura only because I know you as Madhura, doing great job in homeopathy. and psychiatry. And I'm happy because of this note, my all PG students will get benefit of this and how to go with the positive study and how homeopathy works with the cases at what she has shown you. You are going to learn more, and we can call her again to explain you about the psychotherapy and homeopathic management in mental disorders. Everyone is having all problems in life, but if you'll take it in the positive sense as a doctor and helping out to your patients, it will be a great, and you can cure the patients with homeopathic treatment and positive attitude and positive values, what you're going to tell it to your patients, as she's rightly said. And all of you are going to be a practicing doctors, as it is you are practicing because you are doing your PGs over here. So I hope you have understood what she's saying, and she's doing a great job, and you had learned a lot from this. So be positive, have a positive waves around you, and a happy person you will be there once you are having all negative thoughts going out or removing it out. As she rightly said, it is a part of life, it comes, but you should always think positively since you get up from the bed till you sleep down. Thank you, dear Madhura. Thanks again.
Thank you so much, ma'am. Thank you so much.
I'm again happy. My student is doing good. Your lights are best and they're doing good over around.
Totally agreed, ma'am. Totally. And how I wish that I can really come back and sit on the bench and listen once again to all our teachers teaching these wonderful things, because that's where our foundation was laid. I don't think that if we didn't have teachers that we have in YMT, and specifically I can say that I had wonderful teachers in form of Sneha ma'am, Varsha ma'am, because I am teaching now as a in the department of organon, and I still have the notes that I've made in my lectures what Sneha ma'am and Varsha ma'am had taken for us. So I always feel blessed that my start of journey started with YMT.
Homeopathy is great, and always YMT is always best, I feel. We make student learn and practice homeopathy. So we are having good students again and again with us. Nice talking with you, dear.
Yeah, thanks, Pagi ma'am.
Continue.
Yeah, thanks, Pagi ma'am. We would like to continue the session with the question answer Q&A by the students and staff if they have attended. Yes, Ananya? Yeah. So
Yeah, sure.
Yeah, so this will be conducted by Dr. Sampada. Dr. Sampada will convene the Q&A session. Yes, Dr.
Sure.
Sampada.
Good afternoon. Here are two questions. First one is, can you explain cognitive diffusion as a psychotherapy procedure?
Okay, so as I said a little bit already, but I'll just again revisit that. So cognitive diffusion is the term that comes from acceptance and commitment therapy. Okay, so it's a term coined for the fact that where we have to know that negative thinking and positive thinking, these terms are not something that we should ideally use. We use actually helpful thinking and unhelpful thinking. Okay, so many times in situations, our mind tends to think the worst case scenario. Our minds tend to jump to the conclusions. Our mind tend to disqualify positives. For example, suppose if I scored less marks in my exams, okay, in one subject I scored terribly bad, I start getting a thought that I am such a failure, right? Now, this interpretation of that event is going to happen for a while. Who goes into problem? The person who is not able to leave that thought and move on. Okay, अच्छा ठीक है, हो गया सो हो गया, अभी आगे बढ़ते हैं, अभी let me see how can I work better in that subject and score better marks. That person will not suffer from a psychological issue, but a person who holds on to this negative thought, who gets fused to this negative thought, who gets hooked to this negative thought, will eventually end up into depression, thinking that I'm a failure, I'm a failure, I'm a failure. Okay, so cognitive diffusion is nothing but we teach the clients to not stick to our negative thoughts. It can never happen that we're always flowery and shiny and we never think negative and we never think irrationally. Okay, mind is mind, it is made to think, it will think in his own anyway. Right? So what is important is we don't stop any particular thinking pattern. Our aim is to first let the clients understand that you first stop sticking to any negative, unhelpful thought. Okay, if thinking I'm a failure, is it helping me anyway to improve my grades, to improve me as a person? If no, then I don't need to stick to it. I need to unhook from that thought. That is nothing but cognitive diffusion. So teaching clients to unhook first from a negative thought. Unless and until you are so fused, you won't be able to change this. Okay, it's like we say that I see a mountain. If I say that I see a mountain means I cannot become a mountain. Something that I notice, I won't become that. For that, I have to have a distance from my negative thoughts. If I want to not be my negative thought, if I don't want to be a negative person, I need to distance myself from negative thoughts. I need to unhook from my negative thoughts and leave that gradually. Okay, so this process is nothing but cognitive diffusion, which is taught to clients via various activities. One of this activity was what I did just now with you all, that is the cup and the mug activity. So I hope that might answer.
Thank you. And second question is, family therapy is a part of psychotherapy or it is different than psychotherapy?
So psychotherapy is an umbrella term for various processes that we use. One of the processes is family therapy. Okay, so couples therapy, family therapy, all these are coming under the psychotherapy only. In family therapy, what do? We call the family members. We try to make them understand, perceive situation in a different way, in a healthier, helpful way. In this child's case, for that matter, if I want to talk to the parents, I want to work with them on better parenting styles. I want to work with them on communication styles. So I have to first see what are the defects in their communication. I have to explore their conflicts. I have to heal them first, right? So family therapy comes under the process of psychotherapy. It is one of the psychotherapy only. It's not like something different science as such.
Thank you. So no more question here. So I conclude here the session, question answer session. And I will thanks to all. Good afternoon all. On behalf of Dr. J.D. Cole Foundation. Wait.
I'm seeing a question in a chat box. Can I address that? Yeah, there's just no
situation
question.
where we can't change the surrounding environment like family situation, then how can we deal with that patient cope up?
Excellent question. This is what we always face in any psychiatric condition, because what happens is, I say that psychiatric illnesses is not an illness of one person. It makes sick the entire family, or many times a person is sick because of the family or the people around him. Okay, so it's not restricted to just one individual person. So yes, most of the times it happens that, specifically in children, in all the cases of children and adolescents where I have encountered, I've seen that families and the way parenting styles have been, or the way surrounding or environment has been, is majorly responsible for the way the adolescent or the child is having those problems. And yes, you're right that most of the time, in this case also, what you're seeing is that I haven't yet gotten a chance to actually bring about significant changes in the family and the parents. What we do, we work on patients, right? So what I have to teach my clients in such cases is how they can accept and make peace with the surroundings. That is where acceptance and commitment therapy comes in, right? That things can go around you very badly and things cannot be under your control. What are the things under my control? At least we work on that. There is a concept called a circle of control in psychology, where we divide our life situations and people around us and our stimuli into 3 circles. One circle which comes in center is the one which you can control, that is you and what goes within you. Everything that goes outside you is always going to be beyond our control. So we work on that aspect. We make the client understand that there are situations which you might not control. Your parental attributes you can't control, but what you can control is how you feel about that. That's where cognitive restructuring comes. So when a patient comes to me and says, why can't my husband just understand this? What does it take to understand a simple thing that he needs to care for me when I'm sick? Okay, now this is an expectation, and yes, she's right that she's really sick and husband doesn't care. But husband can't be changed. Then in that case, I have to work on acceptance of my client that he can't be there for you, or he doesn't want to be there for you for whatever reasons he has of his own, but you can make yourself independent and emotionally independent. I'm not talking about physical independence, and we can find out different other via medias where you can still feel cared and loved. Then that's where the concept of self-care comes, self-love comes. Okay, so we work on the client and we develop acceptance strategies in the client, and we develop resilience in the client कि बाहर के आसपास के लोग कुछ भी करे, कुछ भी चाहे, I will not let my sanity ruin because of them. So working on acceptance, that's the main crux. Yeah. So I hope that answers your question, Fareen, maybe.
Thank you, ma'am.
Thank you so much.
Here we end the question answer session.
Thank you, Dr. Sampada. Now I would like to call Dr. Sneha Bhosle ma'am to conclude the session.
Ma'am,
Ma'am, your volume.
mute. You are on mute.
Towards the conclusion, I would like to say quite an interesting, interactive, and a very lively session, giving us the glimpse, okay, of psychotherapy, really what it has got to do. And interesting would be if we have such live sessions, that would make it more effective. The session definitely had an integration not only of psychotherapy but also integrated, conceptual and practical learning. The case proved to be a binder, okay, towards integration of actually how it can be done. Okay, the case helped to bind these concepts. Further, Dr. Ananya also, gave the various components of psychotherapy in the form of various REBT, CBT. Okay, she gave the progressive muscle relaxation, PMR therapies. So this introduction and this influence of psychotherapy into homeopathic practice would go a long way. The case formulation chart also had a lot of integration of biopsychosocial causes and the disposition, that is the patient, towards the strengths and weaknesses that you put on the last border. So in throughout the lecture, the series was seen a lot of integration at various levels, and towards that I thank a lot. The group also proved to be very cooperative and participant, but would like to have more participation from the group, because this is all about interaction, okay, and sensitivity building. So thanks a lot. I would also like to thank Dr. Page ma'am for being so humble enough and come in between, though there was, again, I repeat, some mismanagement. So towards the end, I call upon Dr. Sampada now to do the vote of thanks. Thank you.
Thank you. On behalf of Dr. G.D. Paul Foundation, YMT Homeopathic Medical College and Hospital, Argan, I, Dr. Sampada Ravle, Assistant Professor of Organon Department, would like to thank you, respected Dr. Dr. Ananya Chitre ma'am, for such an interactive and inspiring session. I would also like to thank you, our chairman, Dr. G.D. Paul, sir, for his blessing. And I would especially thank our principal, Dr. Page ma'am, for her constant support and encouragement. I further extend my hearty thanks to our Dr. Bagal sir, who is the Dean Faculty of MUHS and Vice Principal, our YMT HMC, for his guidance and motivation. Finally, I would like to thank you, the organizing committee, technical support team, and teaching and non-teaching staff for being with us, and many thanks to all the attendees, including UG, PG, and PhD students for patient listening. Thank you all. With this, I conclude the session here. Thank you.
Thank you so much once again, everyone.
Yeah, thanks one and all.
Hey, last page.